Hello, I'll introduce myself while we're getting the slides together, but my name's Andrea and I'm a dietitian working with the community health teams. I also have with me here Jalen and Marwa, if you want to share what you do at the community health team.
Morning, everyone. My name is Jalen. I am a social worker by background, but in the community health teams, I am the mental health and wellness coordinator for the IWK in partnership with the community health teams.
Good morning. My name is Marwa. I am a social worker in my background and an occupational therapist, both. And I work as a wellness navigator with the community health teams, and I'm so happy to be here today. Thank you.
Great, yes, thank you for having us. So we're here to talk about where we work, the community health teams, and we're a part of Nova Scotia Health, and we are located here in the greater Halifax area. Oops. So this is our community health team. We have about 30 people on staff, and we cover the service area of the greater Halifax area. So we come from a variety of different healthcare backgrounds. We have dietitians and physiotherapists that teach our healthy eating and physical activity programs. And then we have our wellness navigators who also teach our mental wellness programming. And they can come from a variety of backgrounds with experience in mental wellness. So nurses, occupational therapists, recreation therapists, and social workers. And then we have our admins who take care of each of our 4 sites that we have throughout the Halifax area. So we have 4 teams. We have a team on the peninsula located on Yonge Street, and we have a team in the Dartmouth area, a team in Bedford, and a team in Spryfield. So between that, we cover all of the surrounding communities of the greater Halifax area. So the main thing we do is we teach health and wellness programs in the community, and we help people to navigate services and resources that are available in our community to help people meet their health goals. And we've been around for a while. The first community health team was created back in 2010. So we're getting close to our 15-year mark of the community health teams. We've expanded our services over the years, but I want to take us back to 2010 when we were first created. So we were created through community engagements with people who are interested in health and also other stakeholders and service providers and partners. And through these community conversations, we learned that people are interested to have health resources and services outside of the hospital, in their communities where people live, in accessible locations. We also learned that there are a lot of services and resources here in the Halifax area, but it's hard to know what service or resources is right for individuals. So we help people to navigate these resources as well. So find the right service that can help you to meet your needs. It's also really important that our services are free and accessible to everyone. So we try to spread out where we teach our programs in community locations to different sites that people are comfortable going to. So public libraries are one of our favorite spots to teach programs. We also teach at different rec centers, community centers, really anywhere we can get free and accessible space that's easily accessible on a bus route. For our wellness navigation service, same thing. We want to be as accessible as possible so we can meet people at our Nova Scotia Health office. We could meet people at a public place like a library, a coffee shop, really anywhere where someone is comfortable. We also can reach people by phone or by Zoom. And with the pandemic, we started teaching some of our wellness programs on Zoom as well. And those programs are open to people all across the province. So again, increasing our accessibility to everyone. There we go. So I wanted to tell you a little bit more about the different programs that we teach at the community health team. We kind of have about 4 or 5 main service areas. So we teach classes about healthy eating, physical activity, mental wellness, also reducing risk factors, and parenting. So those are our main wellness areas, and we have a variety of different programs on these topics. For our programs and services, we have a few guiding principles. So I mentioned it's really important that everything we do is free. All of our programs are free, and whenever we partner with people, the events are free. It's also important that we're accessible. So that's both physical accessibility, locations throughout the community, but this also means offering our programs and services at a variety of different times and days. We teach some evening programs. We really try to accommodate people so that we can reach all people. It's also great that our services are self-referral. So we are part of Nova Scotia Health, and you might think you need a referral from a doctor or nurse practitioner, but all of our programs and services are self-referral, meaning you can sign up yourself. And because we are Nova Scotia Health, we do usually encourage you to sign up with your health card, using your Nova Scotia Health card. But if you ever have issue with that, you can give us a call, and we can see how we can work around that. We also are not disease specific, so meaning we're about wellness. So we teach about how to improve our blood sugar, maybe improve different risk factors like cholesterol and blood pressure, but we're not a diabetes center, and we're not a heart disease specific program. So it's about overall wellness. This is our Community Health Team Wellness program flyer. Some of you may have seen this before. It comes out 2 times a year. Jaylen's showing it here. And this lists all of our free programs over 6 months. So we use this as our tool to promote our services. You can also find this online on our website, communityhealthteams.ca. And it has all of our programs, as I mentioned, in the different community locations at different times, different days of the week that you can register for. So just to give a few examples, with our Reducing Risk Factors program, we would teach programs like how to build better sleep, our pre-diabetes program, and our Your Heart Matters program to learn about blood sugar and heart disease risk factors. Then we have healthy eating programs, and we have topics like food and mood, so foods that we can eat to help our mood and how our mood affects our food choices. We also have a program called How to Make the Most of Your Food Dollar. So how can we use our food budget and still make healthy choices? Then we have programs about physical activity. So some are teaching us what are some activities we can do on our own for strengthening or cardio. And then some programs are exercise programs where you meet 2 times a week and you exercise in a safe environment with 2 physiotherapists. So our balance program and our low intensity exercise program would fit into that category. And then we also have mental wellness. So for mental wellness, we have classes about stress, self-compassion, discovering your strengths. And our parenting programs are in partnership with the IWK. And we teach about, a common one would be how to, My Child is Anxious, and our Incredible Years program. So lots of different topics to choose from, and we're always interested to hear what would community members like to learn about in the future. So at all of our programs, we always ask our community members if they could tell us, what are ideas, what else would you like to learn about? So we're constantly updating our programs and adding new programs to our schedule, because it's really important that we're offering what people want. So that constant kind of engagement of our community is really, really important to us. So that wellness program is one part of what we do, and the other big part of what we do is our wellness navigation. So Marwa is going to tell us a little bit more about what our wellness navigation service is.
Andrea did an amazing job, so some of the information I'll be sharing might be a little bit repetitive. My apologies if it's the case. So as Andrea mentioned before, our team of licensed health professionals that include social workers, occupational therapists, recreational therapists, and registered nurses operates as wellness navigators that offer comprehensive care across all age groups. What sets us apart is our unique approach. We bring together support for multiple generations within a single family unit, which helps in eliminating the need for families to navigate various locations for each member's needs. Also, our wellness navigation system is designed for accessibility, as Andrea mentioned, and the good thing that we don't have a long wait list. We usually get back to individuals within 3 to 5 business days, and it's our services are a short-term support system, and as mentioned before, available to all individuals of all ages. And Jalen, who works also with the IWK, is focusing on parenting and children and youth. She will talk more about this. So our primary focus as wellness navigators is to facilitate behavioral changes and empowering individuals to manage their overall well-being. Through close collaboration with our clients, we address spectrum of challenges, which cover stress, health, finances, housing, mental well-being, and we tailor supports to meet individuals' needs. It's important to clarify that while we actively promote behavioral change, our services don't involve traditional therapy or counseling. However, we do facilitate referrals to ensure individuals get the support they need, and we offer a follow-up to check in with individuals. And we, in our holistic approach, prioritize listening and meeting individuals where they are, foregoing formal assessments. Our services that include providing resources, education, and advocacy, just like the free wellness programs are all free. And accessing our services is straightforward and flexible. We offer phone consultations, online Zoom meetings, or in-person appointments based on the individual preferences. And all that is required is the Nova Scotia Health Card. And the referral process is broad. It allows self-referrals, referrals from various resources, such as self-referrals, family members, community organizations, family physicians, and health professionals. And each site of the 4 offices of community health teams, we do have 2 wellness navigators. Yeah, and that's all what I have for today. Thank you.
Great, thank you, Marwa. So as Marwa mentioned, with our wellness navigation, we do have 4 different teams, and on our teams, we try to be the experts in our communities. So another big part of the work that we do with the community health teams is our community partnerships. So we always try to partner with local community organizations so we can stay up to date and know what resources are out there. So that's a really big part of what we do as well, is trying to stay connected with people, share our information to help get the word out, and also learn more about other services that are available. So some ideas of what kind of things maybe we might navigate people about are on the slide here. So maybe different legal issues that people have, food, so that could be food access, how to access food in your community. It could also be things like nutrition issues. So do you have diabetes and you're not sure where to get diabetes education? Maybe your provider told you, talk to a dietitian, but you're not sure how to do that. We also would do things like recreation. So if you're looking for ways to spend time, you're looking for more leisure opportunities, that's something we could connect you with. Or ways to feel socially connected. So are there different community groups, community lunches, different seniors programs that can help you feel more connected to your community? And then, of course, mental wellness is important, one of our main pillars. And we might connect you with the resources we have or our Nova Scotia Health Mental Health and Addictions program, if that's something that someone needs. And then we also would try to help with housing. I know housing is a huge issue here in Nova Scotia, but some people, maybe someone who's new to Nova Scotia, doesn't know what are the existing housing resources that are available. Is there anything that we can help to do from that point of view? Another thing that kind of sets us out and makes us different at the community health team, we do provide health information, but we also help to support people to make behavior change. So behavior change and asking people what they're really ready to work on, and goal setting is a really important part of the work we do. So we do our behavior change goal setting in all of our wellness programs and also in our navigation appointments. Often when people come to us, they have lots of different concerns and it's really hard to know where to start. So we really help to work with people to prioritize and maybe work out on one thing at a time. So that's something that is a little bit unique about our service. And also, as Marwa mentioned, kind of the time that we have. There's not a long wait list to be seen with us. That is also a unique area of Nova Scotia Health. As we know, there's a lot of long wait lists for different services. We always say we're the right door. So if you're not sure if we can help you, we always do our best to help everyone who comes to our door. So if we're not the right service, we'll help you to find that right service. So whether it's yourself or clients or family members, we always say we're the right people to call. So please refer and come call us and talk to us at any time. For those of you who are located outside of the Halifax area, there's a website called healthyns.ca, and this is our provincial Nova Scotia Health Wellness team. And they teach virtual programs throughout the province, so anyone in the province can join those Zoom programs with the same topics that we teach here in Halifax. They also have a virtual health goal coaching service. So you can meet with a health goal coach one-on-one, and they can help you to prioritize your goals and someone to support you and check in with. We also offer this health goal coaching service here in Halifax in person, but there's a virtual option as well.
Okay, so this is one of the techniques we use in our mental wellness programs, which is called STOP. It should be with 2 Ps. So what is the STOP practice and how does it work? So often we are operating on autopilot, going through the motions, but we're not aware of our thoughts and emotions. One practice that can be helpful to increase our awareness of how we practice, that can be helpful to increase our awareness of how we're feeling or what we're thinking, is called the STOP practice. With practice, you can use the STOP practice in moments when you're feeling overwhelmed and on autopilot. It's a very useful tool for taking a brief pause, even for a moment, to help shift our out of our emotional brain and into our thinking brain, which can help us to gain perspective to choose to respond in a helpful way. The 5 steps can take as little as few seconds to a few minutes to complete, and here is how it works. I'll invite you to participate with me. So try to stop what you're doing and give yourself a moment to come to rest. You can close your eyes if you feel comfortable, and pause and check in with yourself. Take a breath. Notice your breathing for a second. Focus on your breath as you inhale and exhale. Notice the sensation of being here and now. And then observe, ask yourself, how am I feeling in this moment? Observe your thoughts, emotions, and physical sensations. Maybe it's an opportunity to think about your stress symptoms, expand your awareness to take in the circumstances, and notice how you can be in a situation without being ruled by it. And for added support, offer self-compassion as you release tension and stressful thoughts. And the P's are plan and proceed. Consider how you would like to respond by asking yourself, what do I need to do in this moment? What would be a helpful response to this situation? Try to narrow your focus and take it one small step at a time. You can open your eyes for those who closed it. Yeah, and this is one of the techniques we use to ground our emotions and our stress. And when we use it in our programs, we do provide handouts and we do more discussion around the activity. So, yeah, hope that was helpful. Thank you.
Great, thank you, Marwa. So if you have any more questions and you'd like to come up to our booth, we encourage you to come say hi. This is our contact information I just thought I would share before we wrap up here. I mentioned we have 4 different offices throughout the city. So when you call us, you'll have an automated voice that will tell you to pick one of the 4 sites. Just pick any one if you're not quite sure what community is for you. We'll always help you to get connected with the right people. We also have an email address if you prefer to connect with us via email. It's CHT, which stands for Community Health Team, at nshealth.ca. We also have our website there, communityhealthteams.ca, and we're on social media. We have a Twitter page, a Facebook page, and we also now have an Instagram page. Our Instagram handle is @communityhealthteam. Great. Thank you so much for your time. Great.